Welcome to the SwineTime podcast here at Pipestone. I'm your host, Spencer Wayne. I'm one of the staff veterinarians here. I work with farmers, and they let me record these podcasts, so I get to do this podcast, the SwineTime podcast, where I interview people I work with often, sometimes people that are outside of our company, but people that bring some interesting information or views or just good conversation. Today I have a guest. I always say they're special guests today. Special guest is Dr. AJ Smit. AJ is one of my partners here at Pipestone, and I've known AJ personally for a long time. So AJ, I tell you what, why don't you introduce yourself a little bit, talk about your background briefly. Don't spend like 20 minutes talking about it, but tell us, where you came from, how you got into this.
No, sounds good. Yep. Thanks, Spencer. It's good to be in the presence of a legend here with you today.
Hey, just before I forgot to say, we're going to talk about Ileitis today. So the topic, I should lay that out.
The topic of discussion.
We're going to talk about Ileitis. Now go ahead. Tell us about yourself.
Dr. AJ Smit, like Spencer said, I'm a partner with him here at Pipestone, general practitioner of swine medicine. I do a little bit of mixed animal practice yet, looking at cows and occasional horse, but like the variety, but primarily in the swine industry. Got my Doctor of Veterinary Medicine degree from Iowa State University back in 2011. Started in a mixed animal practice after that, and then started in Orange City Vet Clinic in Orange City, Iowa, where I currently practice now. And in 2018, Pipestone acquired Orange City Vet Clinic, and we became partners at that point in time, and have been doing mixed animal but swine practice up until now. So,
you had told me, we had talked a few months back. I didn't realize this, but where did you work before you went to college even? You were working with Transova or somebody.
So I was a biology teaching major at Northwestern College out of Orange City, and then decided that teaching wasn't for me. So, worked for Boehringer Ingelheim. They had an office in Sioux Center, Iowa, and worked for them.
That's what it was.
When they first came out with their frozen vaccines, enterocell ileitis being one of them, salmonella vaccine, Irivac ALC, and then went around to the distribution partners that they had at that time, where they had the ultra-frozen freezers and essentially did quality assurance and training on the frozen vaccine side.
Yeah, so you were a trainer. You weren't a guy in the manufacturing side of it.
Regulatory affairs I was also involved in, and quality assurance from the manufacturing standpoint of what we produced in Sioux Center, but then in the field. And
there's somebody influential in that company that kind of mentored you along and said, you should go to vet school. You told me, and I forgot who it was.
So Dr. Fred Sick, who is well known at Iowa State University and a mentor to many, was one that I worked with at Boehringer Ingelheim, and essentially, got the ball rolling again and got the interest rolling, and was able to go back and pursue my dream there. So
okay, good. That kind of filled in the gaps. I couldn't quite remember the origin story of the superhero, but for the audience, and we'll get into the content in a second. I've known AJ for a while, and I enjoy working with all the people I get to work with, but I've been on a few trips with AJ and his wife, Lisa.
You bet.
And so I get to see them together, and we were on a social trip a few years ago, and I told him I was going to give him a hard time about this, but AJ sticks out of my mind. When I watched him and his wife together, I remember thinking like, wow, the marriage was substantial. I watched it, like you both were in double harness, pulling the same direction. You could tell on the same page, so much so that it was striking. I thought, wow, that's an impressive
when
marriage.
You have 7 kids, Spencer, you kind of need to be in the same direction and have the same mindset to lead those kids in the right direction, because there's never a dull moment for sure. So
I can see it.
Yeah. So I have 7 kids. Yeah. My oldest is 17 years old on down to 8 years old, and there's 6 boys and 1 girl, and bless her heart, she can hold her own.
One girl.
Yeah.
Okay, I didn't realize it was that off balance, but if she can hold her own against that, she'll hold her own against anything.
Yeah, right.
Okay, yeah.
So we've been blessed.
Yeah, you've been blessed
for sure.
And I also know AJ is a man of faith, and it's great. You're one of my favorites, just because you set a good example on a lot of levels. So anyway, AJ, let's get into the topic.
You bet.
So Ileitis. Just tell us what it is.
Well, this time of year, we're preparing for summertime and summertime heat, and Ileitis is a enteric pathogen that can infect swine herds, and it's endemic in swine herds all across the world, including the United States. So caused by a bacteria called Lawsonia intracellularis. And the unique thing about this bacteria is that it needs a cell in order to grow and replicate. So it's actually infecting those enterocytes, or those cells in the gut, primarily in the ileum and the cecum area, and gets into those cells and attacks the premature cells. So as they grow and divide, that bacteria grows and divides with them, and it causes proliferation of that tissue, which the term porcine proliferative enteropathy comes into play. So it's actually infecting those enterocytes, those epithelial cells within the ileum and cecal regions of the gut, and just disturbing that and causing inflammation and a challenge to those pigs.
Yeah. So as you described that, it's got to be inside the cell. It won't survive outside the cell. It is one of the wimpiest vaccines out there. The frozen vaccine. You've got a live frozen vaccine, and like it dies almost instantly when you thaw it or get ready to use it. So you've got to use it relatively fast,
right?
Because
it's attenuated, so it doesn't cause infection, but it still causes an immune response.
Yeah, but it's just the fragility of it. It's got to be inside that cell, whether it's the vaccine or a live Ileitis. But it's interesting how hardy it seems to be within a population. You can't
absolutely, because if you get a bacterial load into a barn and you bring in a subsequent group, you can still have challenges in that barn as well. So
so fragile and yet sticks around.
The wild type bacteria seems to be pretty.
That's the difference. Is that the vaccine is really attenuated?
Yeah.
Okay.
Yeah.
So I cut you off. You were talking about describing it a little bit. Okay, so that's the bug.
Yes.
And it's a bacteria. I always remember it as it's like a swizzle stick or something. It's a spiral shaped bacteria. It's got kind of a goofy form.
It's got a curvature to it with the flagella on it as well. Yeah.
Okay, so it's bacteria cause that.
It's fecal oral transmission. So anytime pigs defecate, as they always do.
Okay.
Everybody eats, everybody poops, Spencer. So
right. Pigs eat what they poop.
We learned that with our kids' books, right? So fecal oral transmission. So if you're thinking about biosecurity purposes and using the same boots in and out of barns, and you have one barn that you may not have gotten vaccinated for some odd reason from other health challenges, and you're going back and forth, you can drag it around for sure.
Okay. So what does it do? You talked a little bit about it, the proliferation of the epithelium, but what does it look like to a farmer that sees it in his barn? It has different forms, and what does it look like when you post a pig?
So different forms of this disease. You can have a subclinical form where you're not even going to know that you have it, but can still cost you. And as far as feed efficiency and average daily gain on those pigs, and you'll go through the pens and you'll have normal stools, you have normal looking pigs, but you're still getting hit on the production side of things.
You can even have normal stool. I thought you at least have diarrhea.
That's generally how it presents in the more clinical cases once you see that. But you can have normal stools with it as well.
Okay, so subclinical pigs might look normal, but if you did the diagnostics, you'd find it.
You could find it, yeah.
If you did a trial, which we have in the past, you'll see differences in performance,
correct,
conversion and gain.
Yeah, you'll actually lose 3 to 5% in feed conversion, and average daily gain. So if you think about the economics regarding that, we know that a 1% increase in feed conversion costs or will gain you $1 a head. So if we're going the opposite way, if we're losing 3 to 5% due to ileitis, subclinical ileitis, where those pigs aren't converting the feed that they're eating, you're looking at $3 to $5 a head.
Several dollars.
Yes. Yeah.
Okay.
Just from a subclinical disease that you may think you don't have.
Yeah.
And it's still there.
And I was talking about this earlier. Percentage of our clients that use it, I think 15 years ago was 70%. It was much lower. Today it's nearly universal, but not always. You do run into people that aren't using it, and it's endemic everywhere. You think that's kind of fair? It's most people are.
Yeah,
by far.
I would say just looking at the sheer economics behind it and understanding the subclinical nature of the disease, it makes a lot of sense to utilize vaccination.
Yeah, so it's everywhere. Most people are vaccinating. But then follow up to that is if you're not vaccinating, you should be medicating probably, because it's not like you don't have the problem.
Correct.
The problem is there whether you see it or not, because the subclinical infection is very, very likely occurring. If you're not vaccinating or medicating, you're dealing with the impact whether you know it or not.
And that's the challenge, because you get some groups, especially in Northwest Iowa, that break with PRRS or flu or other diseases, and you're not able to vaccinate because there's a specific time frame to use the oral vaccine. There's an injectable vaccine also, which we'll talk about in a little bit, but yeah, it's probably a necessary thing within swine populations. Absolutely, I wouldn't avoid not doing it.
Yeah, don't think you're special. You probably need it.
Yeah,
you're not
absolutely.
the one that's blessed with no challenge. The challenge is nearly universal.
Correct.
So that's the subclinical. What does the clinical form look like? And I know of a few different forms it could look like, but what does clinical look like?
So clinical ileitis, you'll get soft stools, puddly stools, cow pie consistency type stools, and they may range in color from yellow to grayish green, and generally, you'll see the looseness on the slats, and you'll think that doesn't look quite right. Well, it's not, because you probably have it, and you'll typically see this in pigs that are 120 plus pounds, and you can see it as early. The youngest case that I've had was right away in weaned pigs, that we actually had the chronic garden hose gut when you open those pigs up, and we sent it in, and sure enough, it was ileitis on a 3-week-old pig, a freshly weaned pig. So obviously colonized by the female in the sow crate, and that can pass down into the finishing barns as well. They can carry it with them, and it can be a slow, insidious incubation period on those pigs, and 4 months of age on up, you can have clinical breaks.
Yeah, the typical time frame of having something clinical, you said it like 100, 150 pounds,
right?
And I've seen it closer to feeder pig size, where I thought they were, and we found it where they were dealing with the diarrhea from that. But you wouldn't generally have it in the nursery. It'd be something
correct
in the finisher. This is a finisher.
It's unusual to see it early in the nursery period or that young of age, but
finisher, mid-early finishing up to late finisher, which is, I'm thinking of the other clinical presentation. What's the bloody?
Yeah, the bloody stool, the tarry blood that you see on the back end of those pigs that gets smeared all over, and it's a unique color. A lot of times people will say, "Oh, I think I got ileitis because I got dark stools." Well, we feed some copper in rations also that can make that stool look dark.
Yeah.
But this is a unique color, and it's a bloody brown tar look to it, and it's usually a diarrhea consistency, so it's going to be loose. You can also see that bloody tarry stool in a pig with an ulcer, so you need to be able to distinguish between the two. An ulcer pig probably won't have diarrhea. It'll be more formed feces. That's that dark color. And an ileitis pig, they'll get thin-sided because they're not absorbing nutrients. They'll get pale because they're actually bleeding internally. As that bacteria proliferates, it disrupts those enterocytes. They break open, causes ulcerations of the ileum, and in turn, as the disease progresses, that gut gets more inflamed, and the natural immune response to that is to go attack those bacteria that are in the gut. So then we get more of a chronic fibrosing fibrinous.
Well, that's why the intestine gets so thick. You pull it out, it is like a garden hose. You're thinking, what happened here? It looks like somebody spliced in garden hose where the intestines used to be.
So you open them up and you see this intestine that's enlarged, that's thick. It almost has a brain kind of look to it. It's a corrugated look. It's pale and white, and then you open that up and slice that intestine open, and it's all yellow and fibrous and nasty on the inside.
Yeah. You ever see it in sows?
Not as much.
This is where I got you. I'm older.
Yeah.
I've seen it a few times. So I've seen it a couple times in sows.
A few times,
But it's popped up where you've missed, like the gilts. You didn't do it in the gilts. You've missed a few groups, and then they end up going into the population, and you'll see it, and it'll be a very specific segregation section of the parity. So you're like, all the parity 2s have it. It'll just be something that flashes through because they never got vaccinated, and then now they're dealing with it as an adult, and you'll see the same thing. I've seen them shedding casts. Essentially, it's like the form of the intestine gets shed out, and you think this thick lining is shucking out of the backside of the sow.
Pigs have worms.
Yeah, you start wondering what's going on. So it looks really strange, but it's ileitis,
right?
And they'll get pale and they'll die too,
right?
But yeah, sometimes you see it in sows if the gilts didn't get it when they were growing and developing.
So various consistencies of stools. You have the grayish, green, cow pie consistency, all the way up to like an orangish, yellow, bloody diarrhea, watery diarrhea, and then the dark bloody melena.
So subclinical to clinical, and the clinical can look different. But one thing from saying, one of the takeaways is nearly everybody's going to have some challenge with it. So if you're not vaccinating, you better be medicating or some combination, because it's extremely likely that it's costing you somehow, either subclinically or clinically.
Absolutely. And we have 2 good vaccines on the market today, enterocell ileitis and then porcellus ileitis.
Yeah, describe those two, Willie.
Enterocell ileitis is the Boehringer Ingelheim form, the oral frozen form. There's also a lyophilized non-frozen form that can be used in certain situations. But frozen vaccine has to be kept at negative 70 degrees Celsius, which equates to like negative 96 Fahrenheit or colder.
Cold.
Okay. Super cold.
Colder than we get to experience in
Absolutely.
wintertime.
So they manufacture that, and then they dunk it in dry ice, and then they move it over into those ultra-low freezers where it's kept in their warehouse, and then ship it directly to the end user for them to utilize.
Yeah, and this is probably a good opportunity just to point out something that we're used to talking about, but if a guy or a gal or whoever was receiving the vaccine, I've seen it so many times every year, where they'll get the frozen dry ice product, and they'll see it, they'll open it up, oh, it's on dry ice. They will take it out and they'll put it in the freezer and say, well, I'll just toss this stuff or let my kids play with the dry ice, and I'll use this vaccine in a couple of weeks when I need it. Don't do that. Because the regular freezer, it will die. Not as quick as it will if it's on the countertop, but it will quickly start to
And there's
to
a
decay.
little bit of a shelf life in a normal non-frost-free freezer. So you don't want to, if you are going to put it in a freezer, it's best to keep it in the dry ice in the box, put the whole thing in the freezer if you're not going to use it right away.
Right. Yeah, so there's a little forgiveness if you get it cold, but you don't have much of a time window.
Right. I would use it as soon as possible when you get the vaccine.
And the negative of the frozen product, and we'll get to the injectable one, but the negative is just to manage it. It dies so quickly once it's thawed, and so you got to get it in. You got to do all these things as far as getting it bled through the lines correctly and use the stabilizer. And
many people listening today know that you need to get it into your stock solution, thaw it first, take it out of the freezer, thaw it
in a microwave.
Right.
No,
that'd be great.
Please, I'm being sarcastic. Please catch me and clarify. Not
it's
in
got
the
an
microwave.
aluminum top to it. It's just like sparks. Just kidding. No, in a water bath, a cool water bath.
Okay.
So you don't want to use hot water from the tap. So if you have a sink in your barn or a bucket in your barn where you can run water into, run it directly through a hose or into the sink with the cold water running.
Cold water.
It's going to take, those 100 ml bottles are going to take about an hour to thaw out fully.
Okay. But it's this very smooth cold water thawing. It's not, you're not putting hot water.
Right.
Things will stress this vaccine, so you're trying to take it totally easy. Now
and even if you go and pick some up from a retailer or someone who may have an ultra low freezer, to set it on your dash and let it thaw as you get to the barn, that's probably not the best practice either. You really need to get it into a water bath and have that consistent cool water around it, because those bottles, as they thaw, they'll produce some frost on the outside and they'll actually stick together too. So you gotta try to get them apart so that they have an even thaw.
Yeah. So it's super fragile. Now the other kind you can get, you said it comes in a little cake in the bottom of the bottle. So you basically get the cake, then you reconstitute that with some water and you dissolve it, and then that pours in there. You don't have to thaw it, but equally as sensitive.
Yeah. You still want to run that, typically for a 5 to 6 hour period of time through the water.
We won't spend time on it other than it's really sensitive vaccine. Good, but you got to watch.
Very effective, very good. Again, the timing of that vaccine, you typically can do it anywhere from weaning on up until about 10 weeks of age is probably the best time to do it.
Your window, your nursery window.
Nursery window.
You could. I've
early finisher.
A few cases where we've done it like in the sow farm.
Correct.
I work with one with you on that actually.
Correct.
That's that flow. But typically it's done in the nursery, mid late nursery.
Right.
Now
no antibiotics.
No. Yeah. There's
none in the feed.
If you're not comfortable, you talk to somebody that has talked to your veterinarian about the things to avoid, because you can screw this up with antibiotics in the feed, the wrong quality of water. It could be a lot of things.
And then we have the injectable porcellus ileitis, which is an effective ileitis control measures vaccine as well, which can be given in a split dose pattern or as one time injection to piglets, typically at weaning, 3 weeks of age, 24 days of age. Yeah.
So it's more forgiving in that you can just inject it whenever. You don't have to worry about antibiotics or these other things. And it came as its own vaccine, porcellus. You can mix it with it. Well, it's often mixed with the circumvent vaccine.
Correct. Same adjuvants. Yep.
And it's also in the product they call CML, which has it all, circummical and ileitis all in one. So there's a few product options. That one can be way more forgiving but you got to inject it, so it's not as easy to apply.
Right.
Okay.
And it's
both effective.
Standalone porcellus ileitis is a 2 cc shot, so if you need to do other vaccinations, you're looking at mixing the two together or doing a higher volume shot or giving two separate shots.
Yeah, that's what the CML is.
The CML is convenient in that. Yep.
Okay, so you got two vaccine options, kind of two are that are the water, and then you have an injectable kind. So really 3 options. Both effective. Is there any done right? There's no lack of evidence that they work. They work well.
They work well. Yep.
Okay.
Yeah, there's multiple studies out there that have proven efficacy of both products, and taking a challenge study or a challenge model where you go in and vaccinate a group and compare it to an unvaccinated group, you'll be money ahead utilizing vaccine.
Okay. Treating. Let's say that you did or didn't vaccine. Let's say you didn't,
right.
And now you expect maybe worse problems. What are treatment options that a person might pursue if they've got ileitis?
There's a couple of different options. So when we think about treating ileitis, you're looking at, first of all, the time frame that those pigs have till market, and you want to consider withdrawal periods. So each of these water medications that we have, you got to consider what withdrawal you're able to use. But typical treatment, we stick to water medication, and that would be Denagard in the water, Avlosin in the water, lincomycin in the water, Tylan in the water, and even there's some Penchlor or CTC is known to be efficacious against ileitis as well.
There's a lot of things that should work. That's the one nice thing about, if there is a nice thing, it's generally sensitive to almost everything. I think you can even run, I'm probably wrong on this, but neogentamicin, like everything seems to work against
the hard part,
stuff.
Spencer, is sometimes when you catch the bloody melena diarrhea and you have already that garden hose gut already established in some of those pigs, by that time it's a 50-50 on those clinical pigs of turning them around with treatment. And you can inject Tylan 200 into those pigs, or lincomycin we've used too, but you have a 50-50 chance of turning those pigs around. So we need to prevent the other population from turning into that chronic issue.
So that was treatment. Really, prevention is the same concept, but earlier with a lot of the same products.
Denagard, has been effective. We just need to be cognizant of schisis in the feed, as those don't mix.
That's a good point.
Make sure if you have ileitis and you need to treat with Denagard, it's a good viable option. Make sure you don't have schisis in the feed.
And when he says they don't mix, it means if you do mix them,
toxic.
Pigs die.
Yes.
So don't mix them in any form or fashion.
Right.
You didn't mention Carbadox. That'd be a feed option. Mecadox.
Yeah.
I would say super effective, but
super
effective.
Long
withdrawal time.
Yeah, 42-day withdrawal time. So it kind of puts it out of the option for utilizing it at an end stage pig or a finisher pig. So
vaccines work. A couple options.
Yes.
If you're not vaccinating, or if you have vaccinated but didn't get something happened, and you're seeing clinical, you'd only really see it if it was clinical forms of the ileitis. You can medicate to treat them, or if you didn't vaccinate, you can preventatively medicate with a handful of options. There's a lot of options, and they generally, I would say, are very effective. Also, done right, correct. You can control ileitis very well with antibiotics.
And each practitioner may have different experiences with each medication, so I would work with your veterinarian on what is most effective in their opinion. So we have individual treatments with the needle that you can do on those chronic cases or those severe acutely ill pigs. We got water medication, and then there's some feed medications too that you can use as a treatment and as a prevention as you move through the finisher phase. So some of those would be Tylan in the feed. We can run that at like 100 grams per ton for 21 days, and then follow up with a 40 gram per ton till the end of the finishing period to help prevent. So it's a treatment and control, as well as a 42-day pulse of Tylan, 40 gram Tylan in the feed as a control measure if you don't get the vaccine done.
Yeah,
which is another option. Lincomycin in the feed at 40 grams per ton, I believe. Don't quote me on that concentration, but you can also run that.
Yeah, and then just clinically responding to something. Denagard is there easy to go to in the water. Yep. Like, I got ileitis. You can run them on Denagard, or even the low level in the feed, 35 gram Denagard seems to control it well.
Right.
So I should stop and say, this is not a we aren't giving actual advice to producers here. It's two friends talking about ileitis, and so I want to make sure we clarify and reduce legal liability. But these are options, that two people would discuss as things that are commonly done.
Right. Yeah.
So, all right. So we got prevention, treatment. We need to talk about diagnostics. If you had it, how would you diagnose it?
So gold standard diagnosis is get tissues from the ileocecal region, have your veterinarian out, post the pigs, take sections of intestine, formalin fix those, and send them to the diagnostic lab. And they can look under the microscope at those lesions and do a test called an immunohistochemistry test where they can actually pinpoint the bacteria in the tissue. Yes, that's what's causing the problem. That's gold standard. And you can also take fecal samples from various pens, targeting those loose stools. And typically you go through, let's say we have a 1,200 head barn. You go through 5 pens and you take 5 different zones within that pen with even just a teaspoon, plastic spoon into a bag or a conical tube. And 5 of those get pooled into one sample, and you take 5 samples from that barn.
So just
and then you run a polymerase chain reaction or a PCR test on those to confirm if you have clinical ileitis.
I can tell. I can see your background working with the vaccine and producers trying to define it, because I'm thinking I would just go say get a bunch of fecal material from the barn, and you're saying no, pool it this way. You've got it down to a science, but essentially get fecal material.
We've had some cases that we've had to work through. Yes.
Okay. Yeah. So tissue itself, the intestine itself, to look for damage and find it. And the second thing is just fecal samples alone can light it up with the PCR test.
Correct.
Same kind of PCR that we use for PRRS or other viruses or bacteria.
Yeah, so there's a qualitative PCR where you're actually just going to find it, and then there's a quantitative PCR that BI came out with a few years back that you can actually measure the level of bacteria that's actually in that sample.
Okay.
So, and then matter of interpretation as far as what you come back with from those samples and what results you get. So,
okay. So I think we covered it all. I'm going to summarize. You correct me where I fell off or got wrong. It's a bacteria.
Correct.
Affects almost universally. Everybody will have some impact with this. It'd be
really
rare.
Yeah, all pig populations. Yeah,
all pig population. We have effective vaccines that work. They have their pluses and minuses, but done right, they're very effective. Very effective. Then you've got prevention and control with antibiotics. We talked about that, and there's a lot of options. And then we've wrapped up by talking about diagnostics and basically send some intestines in or send some fecal material in.
Correct.
For a couple different types of tests to confirm that's what you got. And also I clarified we're not trying to give advice here other than just discussing what we see in the industry.
One other thing, Spencer, is as you approach some of these challenges, again, we talked about the time of year that it typically happens or stressful events in those pigs' lifetime where maybe we're towards the end of the feeding period and we're taking out the first cut of pigs, and then you see clinical signs flare up. Well, it's the stressful event that causes that to happen. The cortisol levels in those pigs go up, and the immune system is suppressed just a little bit, and that allows viruses, bacteria, whatever to take off.
That's a really good point when you mentioned that there, because the stress in a few different ways. Summer heat. Oh man, if you
see it often in summer heat,
100+ degree days, a string of them in August, you will see ileitis places where you're not used to seeing it right after that. So you'll see it after summer heat.
And the summer heat, topic, we'll get variable feed intakes, and we'll be on and off feed at variable times, and that disrupts the gut as well. Oftentimes producers say, hey, I think I have hemorrhagic bowel. Well, they're actually probably referring to ileitis. They see the dark tarry stools and think it's So there is a difference between the two.
Yeah, and then on that topic, summer heat stresses them, but takes them off feed.
Correct.
And then I've seen it where guys just have a feed out problem. Bins hanging up, or the halo's not working, where they know they've been out of feed. Well, you will see more twisted gut, but you'll see more ileitis. They tend to go together. You're interrupting feed intake. You're stressing the pig. You'll see more ileitis just from feed line issues where you're not getting feed regularly.
Right.
So, okay, that's a good point. So, and as we enter this warmer season and you're not thinking about ileitis, if you stop and pause, it's good to reflect on, am I doing this? Am I seeing this? What might be costing me? Do I want to do diagnostics if I'm not vaccinated to convince myself that I'm okay or not?
Right.
Yeah. Okay.
And then to finish here, we need to consider barn cleanup and disinfection. Yeah. So all in, all out on those pigs is crucial in order to keep that bacteria from spreading. We can do a decent job of power washing and disinfecting, but I would challenge producers out there who have had previous breaks to be sure to use a detergent, whether that's Ag Forte, Atmosphere Ag Forte, or Barnstorm, or other type of detergent to knock down that biofilm before you go in and power wash, and then come back with your Synergize or Intervention or any other disinfectant that you utilize. And
really, where you're going for there isn't like, oh, I'm going to eliminate this and eradicate the. Right. You're reducing load because the pigs come with some challenge already preloaded a little bit. But if you have a heavy load, the pig will encounter more than the vaccine, and their natural immunity is going to be able to withstand. So sanitation is important just to reduce the load.
Correct. Yep.
Okay. All right. Now I think we have covered it all. Unless you think of something else, because you were catching me on the end here. Did we cover everything? I think we've covered everything.
We did. Yeah, absolutely.
Okay. And we burnt up.
I think it's good.
Burnt up 30 minutes of perfectly good time for our listeners and ourselves.
Hopefully for the golden nugget, right?
Yeah.
Make sure you vaccinate your pigs for ileitis, because it makes sense economically and just peace of mind.
That would be very true.
Yeah.
Okay, AJ, thanks for coming on and being our guest here.
Absolutely.
Thank you to our listeners for being part of this experience here, and ask you to join us for the next episode next time. The SwineTime podcast was created for the pork industry and individual pork producers around the country. Hosted by me, Dr. Spencer Wayne with Pipestone Veterinary Services, the podcast contains pork industry news, advancements in animal care, and how to enhance your productivity. Find the SwineTime podcast at www.pipestone.com or on your favorite listening platform.